Title: Cognitive Performance Following Stroke, Transient Ischemic Attack, Myocardial Infarction, and Hospitalization. An individual participant data meta-analysis of 6 randomized controlled trials. Published in The Lancet Healthy Longevity, December 2023. Introduction. Keeping brain sharp is crucial for those recovering from a stroke, as they face double the risk of cognitive issues or dementia compared to those who haven't had a stroke. In certain groups, over a third experience post-stroke dementia, while a similar number have cognitive challenges that don't quite reach dementia levels. However, current data on post-stroke cognitive problems has limitations. Most studies focus on people after a stroke, ignoring their cognitive abilities before the stroke, known as cognitive reserve. Since cognitive problems are linked to a higher stroke risk, and some people have dementia before a stroke, understanding the impact of previous cognitive health is vital. Hospitalization post-stroke can also independently affect cognition, and most studies are confined to one country, making it unclear if findings apply globally. Additionally, many studies don't consistently measure factors that could influence post-stroke cognition. To overcome these issues, our study analyzes data from 6 large international trials, looking at cognitive performance before and after a stroke. This diverse dataset spans 55 countries and considers crucial pre-stroke factors systematically. We aim to determine the cognitive aging linked to strokes and compare it with other events like transient ischemic attacks, heart attacks, and hospitalization. We're also exploring how different types and severities of strokes impact cognitive abilities. Methods: we used data from 6 research trials: Origin, Underjet, Transcend, Compass, HOP3, and Navigate SS, to study the impact of stroke, transient ischemic attack, TIA, heart attack, and hospitalization on cognitive performance. We collected individual data from the Public Health Research Institute for this analysis. Our focus was on participants who underwent cognitive assessments at the beginning and end of each trial. We measured cognitive performance using scores from tests like the Mini-Mental State Examination. The scores were transformed into Z-scores for analysis. We calculated the differences in Z-scores to estimate how much cognitive aging occurred due to these events. Findings: we looked at 64,106 participants from 55 countries. Stroke was linked to 18 years of cognitive aging, involving 1,487 strokes. Transient ischemic attack was associated with 3 years of cognitive aging, with 660 events in the model. However, heart attacks and other hospitalizations did not show an association with cognitive aging. Disabling strokes had a more significant impact on cognition compared to non-disabling strokes. Hemorrhagic strokes were linked to worse cognition than ischemic strokes. In simple terms, we studied data from different trials to understand how events like stroke, transient ischemic attack, heart attack, and hospitalization affect cognitive performance. Our findings show that strokes, especially severe and hemorrhagic ones, have a significant impact on cognitive aging, while other events like heart attacks do not seem to have the same effect. Discussion: this research aimed to investigate the impact of stroke, transient ischemic attack, heart attack, and hospitalization on cognitive performance. The study analyzed data from 6 global trials, involving 64,106 participants across 55 countries. In terms of key findings, participants who experienced strokes during the trials exhibited significantly poorer cognitive performance compared to those with TIA, heart attacks, or hospitalizations. The study also explored how age and sex influence the effects, finding that the impact of stroke on cognition was similar across different ages and sexes. Additionally, the severity of the event played a crucial role, with individuals having worse pre-stroke cognition or severe and hemorrhagic strokes experiencing a more substantial cognitive decline. Comparing these findings with previous studies, it was noted that earlier research often overlooked the consideration of pre-stroke cognitive performance. Severe strokes, particularly hemorrhagic ones, were identified as having a more significant impact on cognition. Transient ischemic attacks, despite being less severe than strokes, still had a notable effect on cognitive aging. Interestingly, hospitalizations and heart attacks did not show a clear association with cognitive decline, emphasizing the unique impact of strokes on cognitive function. Examining the strengths and limitations of the study, one notable strength was the inclusion of a large and diverse population across 55 countries. However, limitations included a relatively short follow-up duration and potential biases associated with participants in randomized controlled trials. In terms of practical implications, the findings suggest that strokes have a considerable and lasting impact on cognition, influencing survivors' lives beyond the immediate physical disabilities. The study emphasizes the importance of early access to treatments that reduce stroke severity, as this could benefit survivors in terms of both physical and cognitive well-being. These insights can guide counseling for survivors and their families, emphasizing the significance of managing stroke severity to potentially prevent cognitive decline and dementia. From a researcher's perspective, the study highlights the effectiveness of simple cognitive assessments, such as the mini-mental state examination, in understanding stroke impacts on a large scale. However, it also acknowledges limitations, such as potential biases and variations in stroke effects based on location. Ultimately, preventing strokes and effectively managing their severity emerge as critical factors in improving cognitive outcomes for survivors.